CEO and founder of Surgistream. We're a SaaS platform specializing in surgical scheduling and logistics. The big problem we're trying to fix here is inefficient communication within this very specific space. Communication really is very inefficient with tracking the life cycle of a surgical case. And it's difficult to do that without a dedicated platform. You've heard about electronic health records, but the EHR is very inadequate for this process. Also, scheduling changes in the surgical scheduling process require a lot of repetitive manual communication, which is a big waste of man hours. And then surgical implant ordering, when it's needed for a case, is still done via email, text, and fax, and phone calls with very little transparency. So I've been an orthopedic surgeon for over 10 years, and I've curtailed my practice significantly to solve this problem. And I know a lot about this process as a managing partner in my group, but I want to take you on a little bit of a deeper dive into the jungle that is surgical logistics. All right, I've listed here some of the common items that need to be tracked for the life cycle of a surgical case, following it in from preoperative all the way to billing and postoperative. Some of those things include insurance authorization, pre-op clearance, contacting everyone involved, the facilities, anesthesia, the vendors, patients, generating the surgical reports, and then the final billing. And if anything changes along that course and you need to cancel the case or reschedule, you've got to track that case, or else that disappears. And a lot of clinics use these paper forms like you see here on the right. They're scribbled on in the office by the doctor or the assistant. They're passed off to the scheduler, and they end up in an accordion folder that's moved around by the surgical date. This happens in small and large practices, and even those that have some EHR integration, it's really just a scan in and gets disappeared within the departments. There's no transparency with this. What I want to do, I want to be able to open up my phone, or use my computer, have my manager do this, or my assistant, or my scheduler do this, and look at one surgical day and know within 3 seconds what the status of all of these tasks are, and know what's happening with the case. And I was unable to find a tool to do that. It creates a lot of stress and burnout trying to use the tools that we have. So everything's separate and compartmentalized. So on the communication side, you get a lot of back and forth text and emails. For example, emailing the surgical facility 2 weeks before, hey, we got to put this case on. 3 days before the surgery, now we got to move the case order. A day before the surgery, a text, hey, is the implant there, or do you have the instruments we need for special cases? The morning of, someone missed the authorization. Oh, we need to get the pre-op, and it holds up the case for an hour. Maybe it gets canceled. That's the communication piece. And then on the technology side, in the center screen is an example of an EHR calendar dashboard. Now, EHRs are great for data collection. They're great for capturing billing events. They're really poor at the logistics process. So what you might see is a schedule that has surgery scheduled, but you don't know what surgery it is. You have to open that patient's chart and find that information. It just slows you down more and more. And then you have, on the device manufacturer side, on the vendor side, these large manufacturers have complex software systems in place to manage on the macro level. When you get down to the ground level, where the rubber meets the road, you see these whiteboards with magnets that represent implant trays to manage their inventory. And I can't tell you how many times I've talked to C-suite device manufacturer executives that know what their inventory is nationally, but each territory, they lose track of trays and they don't know where they are. And it's like this with small distributors, and it's like this with even companies that have over $200 million in annual revenue for devices. That's all just the planning part of it. That's not the execution. So when it comes to the execution, you've got the patient's got to be there, the doctor's got to be there, anesthesia's got to be there, the OR room's got to be available. But the implant requests also are a big part of it, and they lack the transparency and standardization like I talked about. So I mentioned these implant trays and these magnets. This is what they look like. They're large metal shoe boxes. They contain implants and instruments, and they get moved around to the various facilities and put together by sterile processing and wrapped. Sometimes they live on the shelf at the facility, and it's not as much of an issue, but the vendor still has to get there and restock it. And in many cases, because these trays are in limited supply, because they're expensive to manufacture, they get moved around from facility to facility, often multiple times a day, with a 12 to 24-hour processing time. So they're wrapped, they're processed, they're put up on a shelf ready for utilization in a case in sterile processing, and then someone else comes, the OR nurse, the OR tech, and they grab it and put it on the back table. Oftentimes, these rooms get set up before the patients even arrive at the facility. That includes gowns, drapes, gloves, sutures, medications, a whole list of things that gets opened up. Now, if the patient didn't get the right message, or the pre-authorization didn't go through, or the wrong tray was brought, or the wrong tray was opened, or not enough instruments were brought, all of this goes in the trash. It doesn't get recycled or reused for the next patient in the room. It's just a lot of waste, and that's expensive. And that doesn't count the opportunity cost for the OR, and it doesn't count the opportunity cost for the surgeon, and then the inconvenience for the patient, and oftentimes the safety issues that come along with that for the patient. So this whole process creates a lot of burnout and a lot of stress for not just the doctors, but all the staff involved. And it's fast-paced. It's 20 to 50 cases per doctor per month, and it can be very hard to keep track of all this. So this is our solution. It's a real-time communication and scheduling platform with what we point an electronic surgical record, or an ESR. It runs in concert with the EHR and integrates with it to make sure all of these things are easily trackable. These are images from our actual platform, which is mobile and web-enabled and HIPAA compliant. Currently been in use for over 2 years in our pilot city of Las Vegas. Processes 300 to 500 cases monthly. Includes all of these features that I've talked about in terms of case tracking, being able to see everything quickly, but it also includes document and imaging support. Oftentimes you email or send documents to the facility. This includes it, so if any time a case gets canceled, this can be parked. All the work that's been done is saved. It can go right back on the schedule and increase revenue for the facility, increase optimal care for the patient in terms of timely treatment. And this is what we've been using for the last couple of years in optimizing. What makes Surgistream unique is that it really bridges all verticals and provides value for each individual stakeholder. Much of our competition tends to focus on one individual stakeholder and then pushes itself on the other stakeholders just as a tool they have to use to see what's going on, but there's not a lot of two-way communication. We really focused on creating something that each individual stakeholder, the clinics and the surgeons, the surgical facilities, and the device manufacturers and the vendors can all use as a useful tool for their own operations, but then further the efficiency by integrating with each other. And what you can see here on this features overview slide is that Surgistream really provides value for each individual stakeholder where the competition falls short. Our business model has two phases. Our first phase is our SaaS subscription model, which approaches a serviceable, addressable market of nearly $50 million in the US, just within orthopedics. That doesn't include other surgical or procedural subspecialties. And that's just looking at revenue from subscriptions for sales reps and for subscriptions from doctors. That doesn't include the per OR facility fee subscription that we've also included. We move into phase two, which is more of our ad-based business model, with an obtainable market in the US within the billions, because orthopedic surgeons and their procedures and their facilities are high-value, long-term customers in what's a very competitive device industry market, and they will spend a lot of money to increase market share in this space. The interesting thing about Surgistream also, it's not just ads, it's also education. The market does not exist for taking the surgical schedule and using it as a target to deliver product information or educational tools. And the Orthopedic Academy is actually moving in this direction for case-based learning. And they feel that delivery of case information, educational information, continuing medical education opportunities in a timely fashion, just in time when the surgeon or the user has an upcoming case that's relevant and they're more prepared to digest this information, is the best strategy. And we are setting up a marketplace to do that. We launched our MVP at the end of 2019 and went through the UCLA Anderson Accelerator Program in 2021, and then we subsequently became a StartUpNV portfolio company that year. We pivoted towards our subscription model at the end of last year, and we anticipate covering all of our maintenance costs this quarter. We're 90% of the way there, which is very exciting, and anticipate 5,000 to 10,000 monthly revenue by the end of this year. Can I go backwards? Our leadership team includes our CTO, who's an equity partner and has been with us since this company's inception. Our advisors include Mark Jacobs, who's a StartUpNV participant and has deep knowledge in the software sales space and multiple exits under his belt, along with other hospital administrators and device manufacturers, C-suite executives. This is a snapshot just of our early subscription revenue results, predominantly with founder sales, with me, over 30 subscriptions. We've added 3 enterprise facility deals to our lead funnel this past month, include 2 academic facilities and 1 community hospital, which is part of a larger national network. And we've also added our first sales associate this past month as well. We're asking $400,000 in this seed round, although we are willing to oversubscribe it to $500,000. Much of this money is really going to go to development on the interfacing side with these electronic health records, setting up API integrations to really reduce the onboarding time and the sales cycle for this process. And so also really be focusing on some patient interfacing for communication purposes, because that's what our focus is on, as well as some UX, UI improvements, really Surgistream 2.0. And much of the remainder of that fund is going to go towards personnel territory sales managers, and onboarding. We're offering at a $3.6 million pre-money valuation preferred round with 25% warrant coverage and 2 board seats. This is really an exciting space to be in health tech, with an average of 25 to 30 acquisitions and exits annually over the last 8 to 10 years. And we anticipate a 4 to 5 year exit, likely with a company such as Harris Computer that's looking to add to their healthcare suite of software offerings, or a company such as Surgical Information Systems, which doesn't have a community outreach or provider outreach within their ambulatory surgery center management platform. So please partner with us and help us revolutionize surgical logistics. Thank you.
So maybe you can go back over for us, because yours was a great presentation, really game-changing type medical technology or medical process. Maybe explain a little bit for everybody again, kind of what you are achieving.
Sure. So I think a little bit of background is helpful. When the federal government really mandated that everyone move to like an electronic health record, people were familiar with that. And I think, okay, there's going to be this digital system in place that's going to fix the way we move information around in healthcare. And it really just creates this very focused foundation for building on. And then over the last years, it has really evolved into very specialized applications that build on the EHR, which really doesn't do much from a logistics standpoint. It's very closed system. People really get access to it, they can't. So, and it's a very specific space, not a lot of people familiar with it, but the surgical logistics space, it's just organized chaos all the time. And I've seen it in academics and in private space in New York, in North Carolina, in South Florida, in practice here, across all different healthcare systems. And it's just that aspect of it is ubiquitous. It's just chaos. And it's fast-paced. And so you really want technology to work for you, and what was in place did not. So really the motivation for this was coming from creating this specific platform that's going to accomplish this task and help a lot of people get things done and expand the reach, for me personally, from just one patient at a time to thousands of patients and colleagues at the same time.
So it's obvious that this came out in need of profession, but can you talk to us a little bit, does this align also with passion?
Of course, I think I like to see how systems process and work on logistics and organization. And as I moved into a managing role in my practice, working with my partners, I realized we really have the tools, and there were a lot of areas where we were potentially losing revenue and falling behind on optimizing the patient experience and interacting with the various other specialties that we were working with at the hospitals and with sales reps. So it kind of came out of this constant repetitive complaints about how things are done. I feel like there's no one to do anything about it. So we just went for it and tried to put together a platform that solves some basic communication issues. And the passion for me was just seeing people light up and feeling relieved that they had this tool. Every time we have an onboarding system in place where if the reps sign up, they get a PDF. It's like a 10-slide thing. It's really simple. And we pride ourselves on being a really intuitive platform. Every time the rep onboards, I get a text like, "Oh, this is so cool. This is great. Where's it been on my life?" And when we first started, I was working with a sales rep that we had some case cancellations, had to move some cases around, and we have it set up where you just drag and drop on your phone and it notifies, the office manager, notifies the facility, notifies the rep. And so the rep ended up, coming in like 3 days later for the case that got moved. He said, Dr. Luck, I was in the hospital with a good friend of mine who was sick, and I was telling him, sorry, I had to go and come to your case. And I got the text message that said the case got moved, and I got to spend an extra 3 hours with my buddy. Yeah. I've had schedulers, like I go into their office and they've got I was talking about these accordion folders where people are putting in paper scheduling sheets and moving them around. And so how much, what do you use to organize? I use this, I use 2 spreadsheets. I'm like, okay, well we can onboard you. The onboarding typically takes less than an hour to integrate everything, which is extremely fast. And I've gone back a week later, like, how's it going? They see me big hug. And they start crying. One lady was like, literally crying in my arms because she saved an hour a day of her time tracking people down, just less stressed out. So the more and more feedback we keep getting from our customer base, the more and more drives we need to keep pushing the product.
How many times are operations started and then canceled, or because they don't have the right equipment, or they miss something? Is it more frequent than we think?
The one thing that's really frequent is a lot of close calls. They talk about Swiss cheese effect for errors, and everything lines up just right with all the holes, and then you get the cancellation. And I think that's really just the tip of the iceberg. What you don't see is all the near misses. And that's what I talk about, the organized chaos. And there don't need to be near misses, and people don't need to be worried about those near misses. And we're trying to eliminate a lot of those.
So where did you just wake up, not wake up one day, but you just be, I mean, how did this come about? How did you really decide this is something, your passion, and this is what you wanted to change? You got me a little nervous with all the near misses now, so I mean, obviously that maybe it spawned from that, but
for sure. It really, I mean, it was, like I said, it was ever present with my interactions in various healthcare facilities and different people in the industry, but it really was just a back office coffee break with a couple reps I was working with in 2018, and it just came up, and we were just having like a conceptual concept discussion about why is it like this, and how can we can like get our groceries delivered and order batteries and you know, pizza, and all just shows up, and we can't like deliver products for surgery, and everyone is running around like crazy. Why does it have to be so difficult with the technology the way it is now? I was like, you're right, let's just see what it takes to put a simple solution in place. And it just, one step led to another, a lot of friends and family, you know, bootstrap funding, just putting a basic prototype together and good feedback, it's just kind of grown on itself. It's always slower than you want it to be, but we've made continued progress as we've gone. That's been encouraging.
So talk to us a little bit about the future. What does this look like for you as you move to improve this product? What do you have in mind?
Sure. I always have to slow my thinking down because I'm always wearing that macro scale hat, but I kind of like to think of us at the Amazon book stage. Once you figure out the communication piece between various entities, you really can build on that, and the sky's the limit in terms of what you're going to accomplish. Like with Amazon, you know, I envision coordinating drone fleets and having these services hired out by some of these large device manufacturers for delivery of products. There's a whole host of systems that help coordinate registration of various vendors for these companies in terms of accessing the hospital, accessing offices, delivering information to the providers, and all of that becomes a one-stop shop for any kind of delivery of information or coordination of services within the surgical procedural space. So I really see it as a go-to space for all things for that aspect of information delivery, product delivery.
so obviously they're thinking about all the investors are meeting and going over everything. What would be some of the things you would hope that they really understand? There's a couple of big points.
Yeah, I think the one thing for me is that we're kind of at this perfect phase where we have this existing product that we pretty much spend virtually nothing to maintain, and we've shown rapid growth capacity with very little staff and very little overhead. And so that investment award is going to go so far in terms of growth and scaling, really do so much with that money, this phase in the company as a Series C.
Fantastic. Wonderful job today. It takes a lot of guts to be an entrepreneur. It takes more to stand up in front of a crowd of people and talk about that journey. And so applaud you for the work that you've done and the progress that you've made. This is really impressive day.
Thank you. It's been a lot of fun.
Stopping chaos is good.
I think that's a good surgery involved.
Yes.